Imagine curing headaches by drilling a hole in your skull. Welcome to the wild world of trepanation, one of history's oldest surgical practices. Dating back over 7,000 years, ancient healers believed that boring a hole in the skull could release evil spirits, causing illness or mental issues. This wasn't just a random act. Archaeologists have found skulls with perfectly round holes, some showing signs of healing, proving patients actually survived the procedure. From prehistoric tribes to Incan shamans, trepanation was surprisingly widespread. They used primitive tools like flint blades or shark teeth to carefully bore through the bone. Why risk it? Because medical knowledge was limited, and this was one of the few ways they could try to treat conditions like epilepsy, migraines, or even psychological disorders. While it sounds terrifying today, trepanation paved the way for modern neurosurgery and our understanding of the brain's role in health. So next time you think medical history was all potions and prayers, remember these ancient skull surgeons who literally drilled down to the problem. Would you dare to try a treatment that's thousands of years old and still practiced by some even now? Trepanation, also known as trepanation, is not just a relic of the distant past. It has persisted through centuries and across many cultures. Its prevalence is evidenced by the discovery of thousands of ancient skulls worldwide, from Europe and Africa to South America and Asia, revealing holes that were intentionally made, not the result of injury or accident. Some of these skulls show clear signs of bone regeneration around the edges of the holes, indicating the patients survived the operation and lived for years afterward. The reasons behind this practice are as fascinating as they are varied. In many ancient societies, illness and mental disturbances were often interpreted as the result of supernatural forces. Spirits, demons, or curses were believed to invade the body, and drilling a hole in the skull was thought to provide an escape route for these malevolent entities. This spiritual rationale was a powerful motivator for trepanation, blending medical intervention with religious and magical beliefs. Moreover, there were practical observations that might have influenced the use of trepanation. Some patients suffering from head trauma, seizures, or chronic headaches might have experienced relief after the procedure, encouraging its continued use. Though the understanding of anatomy and physiology was rudimentary, early healers were keen observers and experimented with methods to alleviate suffering. The tools used for trepanation were remarkably effective given the era. Flint blades, obsidian knives, shark teeth, and later metal instruments were carefully crafted to scrape, cut, or bore into the skull without causing fatal damage. The procedure required incredible skill and patience, as the surgeon had to avoid penetrating too deeply and damaging the brain. Evidence suggests that some practitioners developed specialized techniques such as circular grooving or scraping to minimize risks. In the Incan civilization, for example, trepanation was practiced extensively, with a documented survival rate of up to 80% based on archaeological findings. This is astounding considering the lack of modern anesthesia, antiseptics, or antibiotics. The Incas also developed methods to treat wounds post-operation, using herbal remedies and maintaining cleanliness to prevent infection. Across different cultures, the social role of the trepanner was significant. These healers were often revered figures, combining roles as doctors, shamans, and spiritual leaders. Their knowledge was passed down through generations, often orally, and sometimes shrouded in ritual. The act of trepanation was not merely a medical procedure, but a sacred practice, intertwined with the community's worldview. In more recent history, trepanation has seen a controversial resurgence in some circles. Certain modern practitioners and proponents argue that drilling a hole in the skull can enhance mental clarity, consciousness, or treat neurological conditions. However, these claims lack robust scientific evidence and carry significant risks. Modern medicine generally regards trepanation as obsolete except in very specific neurosurgical contexts, where removing part of the skull is necessary to relieve pressure or access the brain. Despite its dangers, the legacy of trepanation is profound. It represents one of humanity's earliest attempts to intervene surgically with the brain and highlights our enduring quest to understand and heal ourselves. The practice underscores how ancient peoples combined observation, spirituality, and ingenuity to confront health challenges with the tools they had. Today, studying trepan skulls helps researchers learn about ancient diseases, surgical techniques, and cultural beliefs. It also reminds us of the risks and courage involved in early medicine and how far we have come with advancements in neuroscience and surgery. So while the idea of drilling a hole in your skull might seem shocking or even barbaric, trepanation is a compelling chapter in the story of medicine, a testament to human creativity and resilience in the face of mystery and suffering. Next time you deal with a headache or mental stress, consider the ancient surgeons who dared to drill down to the problem, pioneering the path toward modern medical science.